It's my absolute honor to introduce Erica Sinclair. Erica is the founder and CEO of Health Connections, Inc., a healthcare organization that has been delivering primary care, HIV care and prevention, and transgender health services since 2015, all while connecting patients to essential behavioral and social supports. Her work centers on the needs of vulnerable populations who too often face barriers to healthcare access. With over 30 years of experience in international public health, emergency response, and healthcare administration, Erica has become a recognized leader, mentor, and advocate in the areas of health equity, trauma-informed care, and diversity and inclusion. She currently serves as the vice chair of Milwaukee's first ever Board of Health during the COVID-19 pandemic. Erica led multiple mobile and in-home testing and vaccination initiatives for the Milwaukee community, efforts that earned her recognition as one of BizTime Media's notable heroes in healthcare. Her leadership did not stop with the emergency response. She continues to bring people together across sectors to advance equity and justice in healthcare every single day. And that all of that work has also gotten her recognized this year as one of Wisconsin Alumni Association's top luminaries for 2025. So we're thrilled to have her speaking. Please join me in welcoming a true healthcare visionary, Erica Sinclair.
Okay. Can you hear me now? We're good? Okay. So thank you so much for having me be here today. As Carrie knows and Helene knows, I'm a huge, huge pharmacy fan. Like I'm a fan with a PH. Y'all be like, I love it. And I'm always professing that pharmacists are a part of the team. They're an important part of the team. They're the team that sees our patients more than we see our patients. Like I sell y'all all the time. So I appreciate being here with you all today. And hopefully the love that I have for pharmacy will come through. My best friend is a pharmacist. Actually, three of them are, because we went to UW-Madison. And so we all came up thinking we were going to be MDs, and we started flying off to other parts of healthcare in the process. So is anybody familiar with Alex G. Jr. in Madison? You all familiar? Yeah. So he recruited us, and I didn't go. I went to microbiology actually, but he was one of our recruiters. So he was very, very helpful in making sure that. So I got infused about pharmacy early is my point. So you guys have sold me on this profession being a key part of what needs to happen to have purpose-driven leadership in key places and being able to align your mission, community, and impact. You are at the intersection of all of that. So we need you all to understand some things about how you impact. Sometimes you don't know how powerful you are till someone else tells you. Does that make sense to you when I say that? So I'm here to tell you, you are powerful. Your position as someone that owns a medical clinic that's been in healthcare for 30 years, as mentioned. I started when I was 2, by the way. And I have a 17-year-old. I don't know where he came from, but he just is here and I'm responsible for him. That's all I know. So just so we can get this age thing figured out. But yes, so just so you understand, my background is in microbiology, African American studies, double major in Madison. And then I went into, I actually did laboratory in a chocolate factory. That was my favorite job. And I was like, I can't do this for 30 years, but this was great while I did it. Then I went to clinical laboratory sciences, and that's where I got my first master's at UW-Milwaukee. And there I studied HIV and diabetes. And it was when protease inhibitors, see, I could tell y'all because y'all get this part. I've been saying this to other people, they're like, I don't get it. Protease inhibitors had just come out and people were taking it and they were getting better. I was doing chart reviews at Isaac Cox, that's here, and some people were not getting better, but they were on that new medication. New shiny thing, like, hey, let's do the new shiny thing. Well, they weren't getting better, and the nurse practitioner at that time could not figure out why. So as I was looking through the chart and I'm doing chart review and I'm comparing, I'm like, well, they're on this medicine, but they also have, like, did you see their labs? Their glucose, their levels are off, and they couldn't figure it out. And so we figured out that the same place that the HIV, the protease inhibitor was cutting, was also the same place that you cut when you have diabetes. But they didn't put the two together. And so they thought at that time that HIV was the higher order issue. So they only treated that one. They didn't treat the diabetes. So then these patients got on diabetic medication as well, and they got better. So I was hit by the bug at that point. I was like, what? I did what? And that made a difference in me as a ripple to say one person can make such a big difference in the industry and for people's lives. So if there are people who I never know, I never will know directly personally, but because of that, I'm that person. I called the manufacturer and I was like, hey, guess what I found out? And so we need y'all to update the label to actually, make sure that people know how to take care of their patients better. And they actually did it. I was like, what? You did what? I couldn't even believe it. So at that point, seriously, it was over. Like whatever I needed to say and do moving forward in life, I said and did. And it's on behalf of other people because who else is going to do it? If you don't do it, who else is going to do it? So things like that have always powered my journey as I went along. Even opening the clinic, I don't have anybody in my family to open a clinic. We barely open businesses. Like I don't know this. And so the bug hit me and I was like, well, I got an opportunity to do this. I'm going to do it. So I did. And people were like, how did you know? I didn't know. I didn't know the other things, but I had been in healthcare administration long enough and seen other people do it. So it's a really seriously, why not? And so here we are. I did see the gaps in the delivery of healthcare. I saw a lot of those. I worked for Centers for Disease Control. I worked in global health. I was in Eastern African countries, like people go to Chicago. I was in Kenya and Rwanda and Uganda like that on a regular basis. And in doing those things, I realized the little resources that they had, they were able to do so much. And that was because they were invested in what they were doing. And when I came back to the United States and I came back to Milwaukee, I brought all that back with me because I know what can happen if people are vested. And because Milwaukee is from a place where, and the places that I work in have seen so much divestment, that we need to figure out how to get it back in and get people plugged into care again. And so pharmacy is a huge part of that, is what I'm here to tell you. Equitable care is a human right, and we need to make it a reality for every community. So I wanted to just make sure that you all know I believe in y'all. I trust y'all. Y'all can tell I'm a fan. And it'll be infused within everything that I say today. And yep, I just said that. So then today's session, we're going to examine how purpose-driven leadership can mobilize organizations to address community health disparities and promote equity in access, outcomes, and opportunities. We're also going to identify strategies to align professional mission and community needs in a way that sustains long-term impact and fosters trust across diverse populations. And we're also going to explore leadership practices that build resilient, collaborative teams equipped to navigate change and drive innovation and serve with authenticity and intention. And we know these days that's your bread and butter, because at the end of that and at the bottom of that, in the middle of that is trust. How much trust can you garner from the people that you serve? And how important is that for what the jobs that you do for a system like healthcare, which is we already know is broken. So it's how do we help do what we need to do within our particular roles to help people still get what they need. And sometimes that takes a lot of convincing, but you all as pharmacists are at the center of that. I'm going to keep saying that because I need y'all to believe that. And know that. Some of you all that are seasoned, you already know it. Those of you that are new, you have to know it. And your responsibility is to pass this on to those that are coming into the profession. That is literally your responsibility. So we're talking about defining purpose-driven leadership. So this is leadership because I changed my slides, so I got to read my slides from here. Leadership that integrates personal values, organizational mission, and community needs. So why does it matter in pharmacy? We just talked about it. It builds trust. Build trust with your patients, stakeholders, guide decision-making, enhance workforce engagement and retention. Can you all relate to those things? Who's in here as a direct pharmacist, like you deal with patients every day? Can I get a raise of hands? Okay, so then what do the rest of y'all do? And I'm not saying in like accusing way, but like what else do y'all do? Just throw out something. Who else, what other roles do you all have? Administrative, owners, students. Where the students at? Hey, oh, y'all got a whole section. Okay, I'm talking to the right people. All right, this is great. What schools? Everybody's Madison? I'm a fan of MCW. This is great. I love it. And where's Brian? Oh, he'll tell you. Whenever he brings a student in, my first question is what? Are you staying? That's my first question. I'm like, where are you from? I don't care. Where are you staying? We need you to stay. How important is that? That is everything. That's why we have to have these kind of sessions so people can all get together across the board, across the different levels of experience and things like that to can make sure you communicate with each other during these times and just like check in. And doing it annually is amazing. And it's like a family reunion, so it's a good thing to have. You also want to, though, during the year, celebrate those wins and when you all collaborate with each other. So as we talk through here, I'm going to talk about some of the collaborations I've had with PSW and are having now, actually. And we continuously have both with Immunize Wisconsin, also with Milwaukee Heart Health Learning Collaborative. And we look forward to getting more. And with Hyatt, we've done so many things with Hyatt. It's kind of crazy that we're not the same organization. But we know the value. We know the value. During COVID-19, I want y'all to close your eyes. Just close your eyes. Take a moment and think about when COVID hit. Where were you? When it was declared a pandemic, where were you? Just think about it. And what kind of feeling did you have in your particular role about it, personally and professionally? Now I'm going to call on a couple of people to give their answer. And sorry, y'all that stood in the front because I'm about to call on y'all. I'm coming to you.
I regret it.
Come on, talk to me.
Okay.
Okay. But you were talking here for
Well, yeah, that's fine. A lot of uncertainty, right?
Mm-hmm.
What's gonna happen? What's gonna happen to the people we care for? What's gonna happen to me?
Oh, yes. Talk about it. Talk about it. What you mean? What's happening with you? You think you're gonna get fired? You're gonna like what do you think?
Yeah. Well, I don't know about getting fired, but just
Personally.
yeah,
Yeah.
safety,
Yeah.
right? I mean, I think for a lot of us, it was the first time where, um, you know, just life or death considerations too, right? Like what exactly does this look like?
Mm-hmm.
And
What are we dealing with?
you know, how does this change how we are still able to do what we need to do on a regular basis and care for the community that regardless of what our practice setting is?
Absolutely. That is a perfect answer. You almost gave my whole presentation. So can I get somebody else? Can you get Ryan over here?
I think for me, it was more of a denial, like this can't be real. Like that was sort of where it was for me. And it was like, well, this is somewhere else. This is in New York. This is in, you know, California. This is on a cruise ship somewhere. This isn't here. It won't be here. Right. So I think for me initially, it was like very much in a denial mode of like, I don't really need to worry about this, which clearly, you know, don't trust my predictions, I guess, but
don't bet with you, don't gamble with you. They'll just say, yeah,
that's where I was at.
yeah, absolutely. Kate, you want to give your answer?
Oh,
You got the mic.
I would love to. I would say that I felt very fearful for my young children. I felt, you know, concerned about safety, but then from the healthcare lens, it was like, what do we need to do? Right? It felt like it was a jump into action. What's next? Where do we need to be? Who are we caring for? How are we going to get staff trained to take care of all these people in the ICUs? So I think that it was very much a split feeling. And then that mix of like, how do I make sure I'm not bringing home a bunch of infection to my family?
Yes, absolutely. And so all of those things came into play at that time. What also came into play, and thank you all for sharing, and what also came into play was that we had to figure out, which I heard through all of you, operations. We had to figure out how to operate differently. And guess what? Some of that stuff is still here, right? Some of the things that we learned during that time, which we still have it. One big thing, especially working in public health, is that all of a sudden, it's like the Wizard of Oz. People realize that there's people behind that curtain. There are actual people behind that curtain. And like all of a sudden, everybody was a public health expert. I was like, child, if you only knew how much we do to keep this water clean, how much we do to make sure that you actually have clean air, how much we actually do for all these other things that you don't have to worry about because public health handles it. And at that time, being a public health expert, you felt very vulnerable. You felt more seen than you ever wanted to be seen. You were like, everything's getting scrutinized, and that's just how it was. But it wasn't that we were necessarily defending what we were doing, we were explaining it. And guess what? It's probably was the best thing that could have happened to us. Now, I have to find silver linings for COVID because I know too many people that died. I know too many people that got impacted in ways that has changed the trajectory of their lives. And from that, we have to figure out what those lessons are that we learned during that time. We have to keep that at the forefront. So while we grieve the people that died and the people that got impacted with long-term COVID, we also have to make sure that we're clear that there were some things that needed to be done anyways that would not have happened if COVID hadn't happened. One of the biggest things for us is that we got to collaborate with people that I've been trying to collaborate with for years. And all of a sudden, because Health Connections never closed, we never closed. We were out there because remember, I have a microbiology background. I worked in global health. I worked in TB, Ebola, like I worked with some stuff. So I kind of knew what to do. I was out there in my yellow duck suit though, I ain't gonna lie. I'm glad there's no pictures of that because that was crazy. But I was on my yellow duck suit and I was out in the parking lot and we were swabbing noses. That's what we knew to do at the beginning. And we were swabbing. All of a sudden our parking lot got full because guess what? Nobody else was in that medical office building on Port Washington Road but us. In our parking lot, and the word got out because we had no time to advertise. The word got out, and all of a sudden, that's where people were coming. It was funny because the North Shore Health Department called me and was like, "Are y'all still open?" Like, yes, yeah, because we're getting results coming through here, and we didn't know where they were coming from, and now, so all of a sudden, now we have a great relationship with North Shore Health Department and the police department and the building down the street because we put up this huge tent and we did drive-through testing. And so you see how that happened? Collaboration everywhere. Why? Because the entire world was stuck and stopped. Prayerfully, that would not happen in our lifetime again, but it did. And so guess what? I can never unsee what I saw in the level of collaboration that we were able to witness during that time, which tells me that there's hope always. There's never not hope. There's never not an opportunity. There's never not a way to figure it out. As my friend says, everything is what she say? Everything is figure outable. She kind of created that whole word. You can figure this out, and it's a matter of will. So that's always at the core of everything is trust and will. In leadership, those are key components in leadership. So that tells me that it can happen. The mission, community, impact, connection. Now, we already know, we've been talking about it already, that means that we have to have a mission. We have to know what our missions are. How many people actually know the mission of your organization that you work for? Like, do you really know it? Yeah, I don't see a lot of hands. Wow. I'm not surprised. Because unless that's something like I'm gonna be frank, I worked at Aurora. Aurora like shoves that down your throat. You're like, oh my gosh, I have to say that one more time. It's almost like the Pledge of Allegiance. You're like, okay, I got it. Like again, we doing this again. But I get it, and hopefully, and I understand why they do it. It's because they want you to understand who you work for, what you're doing, but also they want you to drink the Kool-Aid because they want you to show up in a certain way. And so, and especially with pharmacy, you all know the number one thing for you all is customer service. People are coming to you when they are sick and they are trying to get relief. And the relief is between you and that bottle. So you gotta be nice. in order for them to come back, because I have people in my clinic that won't come back. They won't go to certain places. And it's not because they didn't get what they needed, like they got the pills, but it was the way they got it. It's how they got it. The person was nasty about it. The person was like, you don't need this. I don't believe you're actually in pain. Really? How do you tell me that I'm not in pain? How do you know that? And I come, as you know, as you can see, I'm a Black woman, and I'm born and raised in Milwaukee. And I understand the history of the divestment of Milwaukee communities and neighborhoods like the back of my hand. I grew up with it. I have family that have been Black Panthers. My father and mother were Oshkosh 94s. I was the Black Student Union president in Madison and UW Gospel Choir president. So this stuff, we know this is my DNA. So when I see people doing that to other people, I have to be an advocate. And so that's why when I started my own clinic, one of the best things is I get to have a peer-to-peer conversation with somebody when things don't go right. And it's a really nice conversation, actually, because I really want them to fix it. I really want them to fix it. I want it to be better. I want next time my patients come in there, they're fine, they're good, they're happy. They're like, you know what, more people should come through here, because we all have a responsibility in doing that. So when people show up and they're not feeling well, are you really going to be the one that's continuing to actually do the jabbing? You want them to have a good experience. So the mission piece, you have to live that. The community piece is who you serve. And the impact is you. The impact and the impression that you leave on them, that can make a difference between somebody actually taking their medicine and being compliant and not. Does that track for anyone? Does that make sense? They literally may or may not take their medicine because depending on how hard it is to get the medication, that's been a thing. If it's too hard to get it, forget it. I'll just live through it. I'll just live through this pain or this discomfort or whatever. So people that have been divested, they think they live with pain. They think that that's what's supposed to be happening to them. And we're here to tell them that there's another way to be. You don't have to be in pain. That is not how this works. You should not be in pain, actually. And so we can help you. And the fact that the pharmacy can be a part of that in a way that is so more integral than the rest of us can be. Again, you see them every 30 days. I see them every 3 months. So if you all can be, and this is where that partnership comes in. When we have good pharmacy partners, they're the ones that call us and say, hey, Jack Smith showed up today and you put the note in here that says they need to call you. So we're telling them they need to call you. Like that mechanism alone is golden. It is golden for us to help find our patients, to get them back on track with us and to make sure that they're taking their medication properly. So that partnership is key. So mission alignment, we have to embed core purposes in our everyday operations. We have to necessarily community engagement, understanding and addressing the unique health needs of the communities that we serve. That's why when we have Milwaukee Heart Health Learning Collaborative, which I'll talk about in a second, there's a reason why that's important. It's actually, I'm going to talk about it now. Census Tract 1860, which is right down in Bronzeville, if you all are familiar with Milwaukee. It's kind of on MLK Drive, Walnut, Keefe, Holton, and then the highway, I-43. Now that highway did a doozy on us as a community. That highway created a structural impact and upset that we are still feeling today in the Black community, because that's where Bronzeville was. Most Black people came to Milwaukee and did the Great Migration from the south to the north, and they stayed, and that's where they were staying. So they knew each other, and they're like, oh, they come, okay. And my grandmother was one of them. We had people coming through. We didn't even know who we were going to be at dinner any given day, because somebody came from the south, and this is where they're going to come to get their meal and figure out where they can go get housing and things like that. So we were social services before social services were social services. like we were those people. And so we literally were in a green book, like, hey, you can go there, they'll take care of you. And we did. And so that space, structurally, that highway getting built, it broke up community in a very hard way. And you're like, oh, it's just across the way. Well, I will tell you, my own mother's house where she grew up was on the bridge on North Avenue. Like that clearly is not there anymore, but that's where she grew up. And so when they did eminent domain and they took that house away, they had to move in places that they weren't familiar with. And so they had to rebuild and figure out community all over again. And that's a lot. That's a lot. So that impact is showing up these days in what? Lack of access to food, good, healthy food. We just saw Pick and Say is closed. Anybody familiar with that? All the Pick and Says that closed? That made a difference. Because guess what was in those Pick and Says? Pharmacies. People at least got their medication. They got food to go with the medication. Now what is the question? Now what? And I'm a huge person about representation. I don't know who is out there right now, and I know there's a groups of people that are trying to figure out how to get people their medication, how to get their access. But I hope some of y'all in this room are a part of that conversation. And if you're not, we got to figure this out because you all need to be a part of that conversation. That's a healthcare access in a crazy way. It's 5 different pick and saves that got closed. And for most of those communities, that's the only food source they had. So it's a serious now what? They cannot just go outside, go out their door, go down the street and get it. And most of the people in my life got impacted by that, including me. It was down the street from my house, and I live by St. Luke's Hospital, and that's huge. So these kind of things, keep plugged in, understand these things are happening, understand how it happens in the community and what kind of impact it has, not only on the community itself, but how you engage with the community. Know that these things are happening so that you can also be a part of the solution. Does that make sense? You got to stay plugged in is my big point, because that's why how mission, community, impact, connection works, is that people decide to stay plugged in. So that area 1860 census tract, that's the highest, it's the highest percentage. More than 53% of the people that live in that space, in that census tract, have uncontrolled hypertension. More than 53%. That's more than half of those people that live in that area have uncontrolled hypertension. So one of our, we had some of our people, so the Learning Collaborative came together, and it's a grant from the CDC around innovative cardiovascular health grant. That's what it is. And part of that grant includes us creating a Milwaukee Heart Health Learning Collaborative is what we created, a learning collaborative. And a lot of people that are part of it, PSW being one of them, we have organizations like you all, we have healthcare systems, we have FQHCs, we have independent clinics like mine, we have people that are interested residents, because we need them to help with the solution. And so we have people at the table with us trying to help figure out how to help people that live in that area bring that number down. But that's a lot. And guess what's a part of it? The structural barriers. The structural barriers. They don't have good, and so Pete's Fruit Market, it just has been there for probably the last 5 years maybe. And it's expensive. It's expensive. Now they try to do the best they can to serve the community. They give donations. We've gotten donations from them for different things, but it's expensive. That's about the only grocery store that's there. That's it. So now people got to figure out how to get good food, and guess what survived? I kind of laugh about it, but it's not really funny. Kentucky Fried Chicken. I went past and I was like, Milwaukee Health Services across the street, kind of up the street from, and I used to work there, manage the HIV department and the behavioral health department at the same time. Crazy move on my part. I was like, what? Why did I do that? That was a lot. But what I did notice is that you look over here and KFC is still standing. I'm like, how? Out of all the places that could be here, this is the place. Not a salad in sight. I'm just saying. Like, nothing. So then we got into some conversations around urban gardens and things like that. So this is why, again, staying plugged in, being situationally aware, and understanding that those structural barriers matter. So we're working, the PSW is working with Hyatt and a couple other people, organizations, to really figure out how do we get people the care they need so they can help control that, to help address that. How do we make sure that we're integrated in enough to these people's lives that what we do matters for their hypertension? That matters. And so we got to keep plugged in. That impact is ready to go. So then here we talk about strategies for purpose-driven leadership. And some of them are things that we've been talking about. So start with self-awareness. connect your personal why to your mission. So can somebody give me your personal why? You still got the mic? Ask Miss Carrie what her personal why is. Why do you do this? 20 years, ma'am.
Good question. People, I think. It's people. That's all I got.
That's all you got. That's all you need. I mean, you already proving yourself with, you got accommodation. So we already know that people, that makes a difference. Wow. Anybody else, young lady? Thank you.
It's all about the relationship for me, all about the relationship.
Wow. Pass it to Blue Jean here.
Yeah, I think the connections that you make and especially with patients, seeing the improvement in patient health and knowing that you helped get them there.
Perfect. Can I get a student to answer this question? Why do you sign up for this? Okay. Yeah. We need problem solvers everywhere. Thank you for that answer.
The ripple effect is a big one. One small action that transcends and hopefully, oh goodness, I forgot the word, motivates other people to replicate those actions of kindness and exceptionalism.
Absolutely. And what do you personally bring to that?
I'm a huge empath. I love being able to help people and seeing that kindness again propagated outwards and just one good act of kindness that leads to another.
That's movement talk. I like that. I like that. Can I get to the young lady right here in the green? Yeah. Yes.
People, relationships, echo all that. But really, as a leader in my organization, it's about bringing other people up with us.
I needed somebody to say, yes, you gotta bring people with you. That is beautiful. These are the answers that I expected.
I got one more, if that's
Who is
okay.
that? Yes,
For me, it's about the business.
talk to me.
It's about the money and the business and the amount of wasted high dollar funding that our healthcare system takes up in this nation, and being able to analyze it as a business and grow people who can reduce those costs.
Absolutely. Thank you for saying that. Because it is a business. Healthcare is a business. Pharmacy, everybody has to eat, right? Everybody has to have a place to live, right? But how do we do that based on the skills and the fact that we've actually bought into the framework of pharmacy, the profession of pharmacy? We still have to be able to make money. You still have to make sure and not feel guilty about that part. Does anybody understand when I say that? People be like, oh, you make all this money and I deserve it. I mean, people, we don't save lives, like we deserve it. So never feel crazy about that part. Please don't ever feel crazy about that part. Because what's the price of a life? I need if somebody can give me a number one day, I would appreciate that. But whenever I ask that question, I don't get an answer. Every life matters. Every life matters. And put a price tag on it, please do. And that's, I mean, just let me know. And I'm saying this from a knowledge place, not a crazy other kind of place. I just really would like to know what the price of a life is. Because we can't afford not one, because that one life could be the one that saves somebody else's life. So we got to be paying attention as we do this work, that how important our goal is. Pharmacy is hope, trust, and guidance, and make every interaction count because of that. Embed mission in every role. Purpose must be lived daily across all levels. And so I heard that when you said your answer, sir, about what was happening with COVID. You have to live that every role that you play, you have to be thinking about how does what I do now impact me personally, professionally. I'm a dad, I'm a mom, I'm a auntie, I'm a mentor, a mentee, like all matters. So be conscious of that. Partner outside of the box. Collaborate beyond healthcare. So does anybody have anything they want to say about that? Have you all collaborate outside of healthcare in doing anything? When I say healthcare, I mean like the actual like hospital, other pharmacies, things like that. Does anybody collaborate with anybody outside of it? Nobody helps animals, nobody helps feed people. Somebody? Yes.
My wife actually owns with her family a catering business, so they do a lot of public outreach. They've done like veteran homeless drives. They help work with the Milwaukee community and help feed like nursing home facilities. So just kind of from that ground level.
Absolutely. And that matters. We can get out of healthcare. Now, we got a lot of collaboration to do within healthcare, don't get me wrong. But it also helps when you can bring your other experiences from outside of healthcare into healthcare. I know people that take better care of their animals than they do their children. Literally. Their children will be hurt. Yeah, you'll fix it. You'll be okay. You're resilient. But let that animal, let that dog, something happen to that one dog, I have a person in my head, actually. And they going to the vet. They making sure that baby is taken care of. And I'm like, what happened? How come we can't take care of both of them? And clearly there's no resource issue in that space. It's a choice. So we need to do the same thing. We need to make sure that we are taking care of each other and we're taking care of people outside of just the profession that we have. We do a lot in the profession and that's what we need to do, but we also need to pay attention to what else can we get involved in. I will challenge you and encourage you to find other things that you can get into. Do a walk every year. Do a run every year if you're that person. I'm not there. But but if you're a runner, do something every year that you create those habits and that thing where I'm going to show up every year for this thing. Find something because there's something for everybody always to do that, but do that. And I'm going to tell you why. Because there are other people watching you. And that's whether you have children or not. Other people are watching you and they're paying attention to what you do. And there are a lot of people that model themselves after you. And they may not ever tell you, but know that that is happening. The impact is serious. Be a mission-driven person. Be able to make sure that you understand that doing things, people like, and I get surprised all the time. You had mentioned in my intro, I was on the first board of health for the city of Milwaukee. Now, first of all, I was shocked. I was like, I worked for the city of Milwaukee. We did not have a board of health? What? 50 years before we had one. We're the largest city in the state of Wisconsin. How in the world did that get by anybody? I don't even know how that happened, but it did. And it was a full circle moment when I got tapped on the shoulder and was like, hey, we want you to be on the board. I was like, really? Really? The shock, because I was busy doing the work and I wasn't vying or campaigning to be in a position. And it's because people saw what I did and they were like, yep, we need your voice on this board. That matters. And that was me just doing being me. The authenticity matters. Even with Black Grassroots, we have two other organizations that I run, the Milwaukee Black Grassroots Network for Health Equity, as well as Milwaukee Wellness Collective. We do a lot of work. The Black Grassroots, the network we call it, is the policy angle. Because when I hit spots in healthcare, I have to have somewhere to go to get it figured out. I can't use my nurses. I could, because they're that kind of smart people, but using my nurses to go and fight the policy issue is not necessarily the best use of my resources. So I literally have another staff that do policy issues. Some of the big wins that we helped, that we kind of fed into was nurse practitioners being able to not necessarily have to have an MD collaborator. If you all only understood how many years of a fight that was, and for us to even be a part of that fight mattered, and the fact that it actually came through. It's amazing feeling to fight that long for something that basic, because I employ nurse practitioners on purpose. That's like my go-to. I do MDs because we kind of have to, the way the healthcare system is set up, but my go-to are nurse practitioners because they're nurses and because of the kind of care that they give is comprehensive. So they ask about, why did you get that knee? What's happening with your knee and how do we fix it? And they do social determinants of health because that's how they roll. And it's natural for them and that's how they're trained. So we try to figure out ways to make sure that we integrate that into what we do. Empower your teams, provide autonomy, training, and tools. How many people are leaders of in pharmacy that are here? So like managers, supervisors, owners, things like that. Okay, keep that training going. Every opportunity, keep that training going and making sure that people get a chance to use that training. There's nothing like going to get trained and then you can't use it. Like nobody, like I put people in situations, or people call it baptism by fire. I literally was like, you did what last week? Great, you're in charge. They're like, whoa, what? I need you to be ready. But I'm also always like a mom. I'm sitting there watching you like, yeah, she ain't ready. I'm not gonna let you fall. But I do want you to understand that I'm creating leaders. And leaders have to be tested and leaders have to be in positions to lead. So you can't just get somebody leadership training and then never put them in a leadership position. What's that? It's a waste of time, money, energy, like all the things. So use your people the way they're supposed to be used. When COVID hit, we had to go get our oldest patient is 108 years old. She was 104 when COVID started. And we got a call from the North Shore Health Department saying her PSW, or not PSW, PCW, I'm sorry, PCW gave COVID to everyone on her roster. Yeah. I was like, what? How many people? And so they didn't have a way, because everything was still closed down at that time. They didn't have a way of getting to her. So they knew we were open. So they said, hey, can you figure out a way to go test her at home? Because she's, 104 years old. Sure. So I turned to my team and I was like, so I just accepted this assignment. And I need y'all to figure it out. Like, I'm gonna be back in an hour and I need y'all to figure it out. I gotta go. So I came back in an hour. These people, they had a kit together. They had the yellow duck suit. They had the duck suit, they had gloves, they had everything. And like the cleaning caddy, have you ever seen? They had it already. I was, oh, okay. Throw them in the fire. They'll be okay. They'll figure it out. But they did that. And that was our first homebound COVID visit, was with her. And again, she's 108 years old. And we just did a video with her. And she's like, and you all are the reason I lived through 2 pandemics. Do you know what that did to us? I can't even tell you for her in her, we're in her home, by the way. And there was a bunch of us. She invited us to her tea party. It was so cute. And she was like, seriously, I wouldn't have made it if it wasn't for you all. I'm telling you, that was worth everything. I could have just stopped at that point, like done. I don't need nothing else, because that right there means everything. And the fact that I had students, they were AHEC students that came with me that day. It was their first day on the job with us that summer. And this is what they walked into. Man, you can't make this stuff up. You just can't. So the fire that I had was able to get transferred, and that woman said it, and then they just like, man, let's go. And so that fired us up. And now we have 2 more public health students coming out as a result of that experience. We have more coming out. They're just a year behind. But I'm just saying, like, that's the spark that we're talking about. That you get people in those kind of positions and those kind of experiences, and you just don't, just let it fly. Let's just see what happens. And that just, I can't even tell you the feeling that I have as a leader because of that. Pharmacy professionals are often the most accessible health leaders in a community. You are. You are the most accessible than even us sometimes. So know that you being here matters, and securing funding. And I'm so happy you said that about the business piece of it, because that matters. That business part matters. How can we get paid for the things that we do? We got to figure that out. And we have to have people that's doing that part while we're doing this other part. That's why we got to keep this conversation going. We've got to. Common challenges, as we know, are limited resources. We talked about that. Competing priorities and change fatigue. We're about to go through that now, if we're not already going through it. What are we going to do when Medicaid gets cut? What are we going to do when Medicare gets cut? That's going to happen too. What are our patients going to do for their medicine? And these, pharmaceutical companies aren't really helping. And at the level that they possibly could, they're not doing it right now. They might have some stuff that we don't know about happening yet, but we don't know about it. Our patients don't. I can't tell you how many patients I have. And again, working especially with HIV patients, the sheer fear, the day that on July 4th, when pins came out and stuff got signed, the number of phone calls we got that next business day. Man, Miss Erica, what are we gonna do? What are we gonna do? I don't have no answers because it just happened. We don't know how it's gonna happen, like how the cuts are gonna happen. And operationally, I have nothing at this moment. But I do know that we're gonna work together to figure it out. That's all I got. That's all I had, is the hope that we're gonna figure this out. And we can't figure it out amongst ourselves within healthcare. Does everybody understand that? Healthcare itself can't figure itself out. It's broken. We have to get in the community and ask them, how can we do this? And what kind of things do they see? This is why urban gardens are so important. This is why being able to connect with people that have lived through depression is important. This is why it's important to get with people that have had other alternatives, ways of doing things, like the off the grid people. They're probably the biggest assets we have right now because they've been off the grid. They know how this works. So we have to figure out ways to communicate in that way. But we got to figure out a way to stay plugged in. Stay plugged in. Every barrier to care is an opportunity for innovation. Every barrier is an opportunity for innovation. In pharmacy profession, you hold the tools, the training, and the trust to transform those opportunities into healthier, more equitable futures. That's you. You have the opportunity to do that. That person that gets to take their medication and have the mindset to know that they're going to get that medication every month that they need to, there's a sense of safety in that. That they don't have to fight for it. And if they do, they got people in the game to help them fight it. That's what we do. We do our PAs, we call the pharmacy at Health Connections. We call the pharmacy, we're like, okay, how can we figure this out together? What do you need from us? What does this look like? Where is this written? How can we move it? Do we need us? We get medication delivered to us instead of to the patient, so we can get it to the patient. Like, we figure stuff out. And we know that pharmacies deliver to patients, but guess what? Some people don't have places that they live that are safe enough for even that to happen. But they have safety to come to us, or we can come to them. So this is why we have to partner to understand how our operations can collaborate enough for these patients to get what they need. We got to figure this out. We got to continue to have that conversation. The systemic barriers to healthcare are just that. They're systemic. But guess what? With every system, there's always a way. There's always a way. So I'm looking for solutions, and I'm looking for you all to be a part of those solutions, especially like I just mentioned, the pick and saves that closed and those pharmacies that are in there. There are people that are working on trying to figure that out, but you all need to be part of those conversations. You have to be plugged in enough about what's going on with your patients to know how that closure impacted them. And so now, what's the pivot? One thing I talk to my son about all the time is that we got to pivot faster. You know, we take L's, we take blows, stuff happens, we got to move and all that. We got to move faster. We got to pivot faster. Ryan was kind enough to be vulnerable to say he didn't know what was going to happen when COVID hit. He just froze. Well, guess what? He wasn't the only one that froze. A lot of us froze. But then what? Let's get to that then what faster. I love basketball, it's my favorite. And with that pivot, so you can shake somebody and get on to the next thing and get that basket, they didn't even know what's coming. So we have to be in that space. And that's why I love the fact that we have students here. Because guess what? And I'm gonna be vulnerable for a minute. Because again, I was 2 when I had them. I don't know what happened. But even my 17-year-old, he pivots faster. He knows he grew up with, he was born with a computer in his hand, literally. And this stuff throws me off. I'm like, print that out. That's why I got this paper in my hand now. Print that out. He's like, Mom, you can put it on the phone. You can do, I need my paper. And it's okay. We got this generational thing going, but I do recognize the genius in these young people. We have to recognize that. We have to recognize that they have figured out ways to do what we do faster and a lot better. And so we got to integrate them in the conversation, because there's some things that I've been doing for a long time, very manually. And this brother comes in and he's like, Mom, don't you know about this? And I'm like, oh, I didn't. But now that I do, it has changed my life. and I get a lot more done. So thank you so much. But I do want to just say that that piece of it is that we have to integrate, we have to mentor, we have to get people in our profession. I'm talking like I'm a pharmacist. I'm not a pharmacist, as y'all know, but I talk is because it's a we thing. We have to get on in a space where we are taking people with us as we grow. Even if it's a new experience for you, take people with you at that same time. Then because they see things that you don't see. It's crazy. We're on a nature walk and I'm looking at this stuff. I'm like, oh, these are weeds. They're like, no, this is medicine. I was like, what? And it was a young guy and he was an herbalist and I didn't know that. So he was showing me this. He was like, this is how you put it on the mouth. Like that mosquito bite. I don't know what. I thought that was a weed all my life. It was not a weed, but I didn't know that, but he did. And again, the benefit of watching, listen to your young people. They have some answers. They have some connections. There are some dot connectors that we just don't value as much as we should. Listen to your young people. But young people, y'all gotta listen to us too, because we some old heads. We know some stuff. We know some stuff too. So you gotta listen to us, and it goes both ways. And at the end of the day, everybody wins when we all listen to each other. But really listen. So with that said, I'm gonna I want you to revisit and internalize your mission statement. Sorry, did I turn this? Okay, here it is. The common challenges, we talked about that. So your call to action. So the recap is there's purpose, alignment, partnerships, and measurement. You need to, now a way to measure your partnerships is when you're in crisis, who shows up? That's a crazy time to figure it out though, right? So one of the things that you had mentioned in my intro, I did emergency response preparedness. And one thing about emergency response preparedness is that we all should be in that space right now, personally and professionally. You should be preparing. You should not wait till the accident or the blow up happens in order to start calling people. Start creating those relationships now, so that and the plans now, so that when the emergency hits, you already know what the plan is. Or at least you got the relationship to call somebody. I can't tell you how many times I called Hyatt and was like, hey, I need vaccine. They'd be like, oh, okay. And then we figure out what that looks like. Or I'm like, hey, we need some more people to show up at such and such. They're there. You got to do that relationship building before then. So is anybody familiar with one-on-ones? I'm a community organizer. One-on-ones is at the core of what we do. And it's as simple as, it's simple. Hey, how are you doing? You're good? Okay, great. So talk to me about, and I'm not going to have you do this, but just talk to me about who you are and why you do this work and, what does that look like for you and why is it important? You're trying to get at there's people's why. And then you want to figure out, well, so how have you been doing it? And then this, and then and in doing so, because I'm a dot connector, you're figuring out, oh, I can help in this way. I can collaborate in this way. Well, let me tell you about me. This is what I do. So we can, and then you figure out those things in that conversation. The conversation doesn't have to take about an hour to get a good one in, but it's important for you to do it. So I'm encouraging you to figure out who you're going to have the conversation with next in this room and outside of this room. That's my call to action for you. Who do you know that you need to have a conversation with in this room and outside this room to create those relationships now so that when emergencies or urgent pivots are required, that you have a go-to, you have somewhere to go. The next thing is action steps. Now, internalize your mission statement, deepen one community relationship. I was ahead of myself. Deepen that community relationship and share an impact story. So do sit with what we talked about today. What is your impact story? Why do you do this? What is something that happened to you during your profession that made a difference for you to keep going? What was that? Make sure you have that ready to go, like as they say, in the trigger, so that when you need to say that to someone, that you're ready. And sometimes you got to practice, the elevator speech thing. That's what you need to be ready to do. And then build your legacy. Mobilize trust, advance equity, and shape healthier communities. Literally mobilize trust. Have trust happen wherever you are. You should be so trusted that people just, when they talk to you, they're like, oh, I can get with that person. Oh, I think this person wants to tell my secrets. Oh, at least whatever it is level of secret that you're having there. When you're dealing with people's medication, And especially, and I'm gonna say this from a Black community standpoint, we don't like people in our business. Are y'all familiar with that? We do not like people in our business. That's why even giving family histories for us is hard. There are things that happen in my own family. When I say family, mom, dad, grandparents. And when we at hospital at the clinics giving our family history, a lot of times our family histories are blank because we don't even know what grandma died from. We haven't had that conversation. And when we tried, we got shut down. So we have to have ways of being able to trust the people that are taking care of us. And that includes pharmacy, because you know all the things. You know our business. We got to trust you. So that means if you know that, then we trust you and we're coming to you on a regular basis. We're trusting you. We're building trust with you. So with that said, you can't, of course, you will not go out because that's an oath and you won't do it. Go out and tell people, oh yeah, you know she got HIV? Oh, did you know she's getting tested for yeast infection? Did you know, or treated for? Did you know, like you're not doing that. People need to trust that you're not doing that though. Does that make sense? Like you can't show yourself untrustworthy. Trustworthiness, and that goes back to the beginning of the conversation. Trust is the number one. We have to have trust with you. Otherwise, we won't keep coming to you and we won't get healthier. You are at the crux of all of that as pharmacists. Please know that that is important. And that is what's needed in order for us to grow this legacy of healthier communities together. So I have another quote, but I really wanted to say was, today I'm encouraged by being in this space with you all and having this conversation with y'all. And the answers that you gave today are ones that I won't forget. So as much as I was here to impart some information to you all, I've been fed. I've been fed by your answers. I've been fed by your dedication, and I appreciate that. And I do appreciate it too, especially because my son is here to see this and be a part of it. And he's about to go off to college tomorrow as a freshman. And when I accepted this, I knew that this is like this is the timing it was going to be. And the fact that he could be here today, I appreciate you all including him. And it matters. It matters because this is what we're talking about right here. We're talking about how you have to train up. You have to have people be in experiences like this so they know that this even exists. Because guess what? Whoever's not in this room, whoever's not in this profession, who have not ever been here, they don't get a chance to feel it. They don't get a chance to feel this camaraderie that's here. That this is a profession that has legacy, that has continued to build legacy, and that they're a part of an organization that is continuing to help them do that in very, very tangible ways. And that is not always accessible to us as people that do this profession. This is huge that you all are here today. I want you all to just know that this is important. Keep doing the family reunion every year and make sure that you understand to bring somebody else. That's your other challenge. Your call to action is to bring somebody else that's not in this room right now, bring them next year. And throughout the year, create those one-on-one relationships so that when you ask them, it's not a surprise. So you can't do that. Like, that girl ain't talked to me all year. Now she's gonna ask me. Don't do that. Have it be something that's natural because you've been building that relationship with them this whole time. Everybody agree to that? Can we agree? We need some more people in this room. We need more people here. I'm thinking of like 5 different pharmacists I'm about to call when I leave here. And be like, girl, where were you? You're supposed to be here. But it matters. It matters. And that's how we do. And I'm going to use my social capital to have that conversation with them. And I'm asking you to use your social capital to have that same conversation with people. Get people here and get people plugged into what PSW is doing. I am on you all's list, and I get you all's mailings and things like that. And I'm always amazed. I am like, actionable, let's go. This is health equity in action. And I'm down with that. One of the brands that we have is Wakanda 365. And that's Wakanda behavior right there. And I'm drawn to that, and I draw other people to that because it matters. We have to continue to build a legacy, and we have to take care of each other. So whatever you do, make sure you get to a person that's in here and one that's not. Create that relationship, bring more people back with you, bring at least one person back with you, but don't have it be the first time that you talk to them. That invite can't be the first time. Is everybody agreeing to that? That's great. And for that, and with that, I bid you adieu, and thank you so much for having me.
Thank you. I have a feeling that if we go right, there, yeah, CE code. All right, thank you very much, Erica. As everybody is thinking about planning for your afternoon and tomorrow morning, you can choose your own adventure. The Educational Programming Advisory Committee, comprised of PSW volunteers, has curated a lineup they hope offers something for everyone. Tomorrow morning, those looking for coffee and information, Vertex will offer a breakfast at 7:30 with a presentation titled "The Role of," suzetrigine. I think I got that. I'm an informatics pharmacist, guys. I don't know things anymore. In acute pain management. So join the early risers in 102 DE tomorrow morning, and the tomorrow morning will also include the Wisconsin Residency Program Showcase. All right, now as we wrap up, the exhibit showcase and poster session is open in Grand Ballroom C and D, featuring posters submitted, many of which are submitted by pharmacy students. There will not be CE available for the posters, but we will have folks reviewing the posters and providing good mentoring and feedback. Thank you to all who are going to be doing that poster mentoring for your engagement. After you view a few posters, I encourage you all to enjoy some networking and learn more about the latest and greatest that's being offered with our exhibitors. You can grab your lunch and join us at a sponsored session by AstraZeneca, also titled Addressing OCS, Use in Severe Asthma in 102 DE. That wraps up our general sessions for the day. Thank you all for attending this morning and have a lovely afternoon.